Hello everyone! This semester we have discovered public health. According to accusation from the World Health Organization, public health is defined as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. For me, by preventing health problems, people can spend more years in good health. The curriculum for most public health courses conventionally include subjects such as epidemiology, health policy, health promotion, health management, environmental health, human biology, and health economics. In the 21st century, the focus has expanded to address new epidemics of ill health, resulting from drug abuse, obesity, and smoking. But through this research, I want to raise the issue of HIV. So, what is HIV? HIV is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS. HIV infection in humans come from a type of Central African chimpanzee. The chimpanzee version of the virus is called immunodeficiency virus or SIV, was likely passed on to humans when humans hunt the chimpanzees for meat and came into contact with their infected blood. Studies shows that HIV may have passed from chimpanzee to human as early as the late 80s. There's so much about HIV that we may not know, perhaps because HIV is still taboo, or we are simply not interested in this topic. So, the first one that I would like to tell you is that HIV is not the same as AIDS. HIV is the virus that leads to AIDS. You have AIDS if your CD count falls below 200 or when you have certain infections or cancers. You can have HIV for years without having AIDS. Being infected with HIV doesn't mean that you have developed AIDS. Additionally, people with HIV who start treatment early in their infection, continue treatment, and have undetectable viral load can stay healthy and prevent the disease from progressing to AIDS. The second that I would like to tell you is that HIV cannot be cured. There is currently no cure for HIV, but with current medicine, people can lower their viral load, amount of HIV in the blood, yes, to the point where it is undetectable. This means your viral load is less than 40 to 75 copies in the blood sample. An undetectable viral load doesn't mean they no longer have HIV. It's still possible to pass HIV to other people, although the risk is much lower. Having an undetectable viral load also helps prevent progression to AIDS or other infections. Research is ongoing that could lead to new treatments and new ways to prevent HIV infections. Meanwhile, women with HIV live full lives including work, the birth of children, and full participation in their communities. The next piece of information you should know is there is no vaccine to prevent HIV. Yes, HIV is a complicated virus that changes over time. This makes vaccine research difficult and takes time to conduct research. Researchers are closer to developing a vaccine to prevent HIV and a vaccine to treat HIV and AIDS. But unfortunately, I had to say this. You cannot know if your partner has HIV unless they are tested. It may take years before you see HIV symptoms. This is called the latency period. I would like to add that you can get HIV by shaking hands, using the public bathroom, or coming into contact with sweat or tears or someone's eyes. The only body fluids known to transmit HIV are semen, vaginal fluids, anal fluids, breast milk, and blood, including menstrual blood. I also mentioned earlier that the subject is still taboo, while study shows that this virus may have passed from chimpanzees to humans as early as the late 18th century. That is because of the stigma. Many have stigma that this HIV-infected person is bad people, drug addicts, and sex offenders. Regardless of the stigma that circulates, it would be better if the public knew how to prevent HIV, right? Forms of discrimination in the family are marginalized, when the family should be the primary place where the patient receives support so that they can prolong their life and quality of life. This discrimination can alter the lives of those who suffer from it by affecting physical, physiological, and social pressures, and even depression. The negative label and discrimination they have received can affect the victim's perspective on themselves or their self-concept. I'm Euodia Stella, under the guidance of Sir Charles Bonar Sirait. Thank you so much for listening me. Goodbye and see you again.